Hello and welcome. Today I'll be talking about miscarriage due to antiphospholipid syndrome. What's that? If you just said what's that, then this video is for you. Antiphospholipid syndrome, what does that mean? We know that miscarriages do occur and can be a very troubling time, very disturbing time for couples. And today I want to address a particular reason why some women have recurrent pregnancy losses. If you're able to get this video across to someone who you know has suffered from this condition, in other words, has been having recurrent pregnancy losses, that could really be helpful for that marriage. So miscarriages do occur, and there are so many reasons why miscarriages occur. But today, the people that should be particularly interested in this video will be those that couples struggling with infertility, because of course if you have recurrent pregnancy losses, you don't yet have a child, or you have had one child before and you've been trying to have another child. Unfortunately, you've been having recurrent pregnancy losses. You should watch this video. Number two, patients that have recurrent deep vein thrombosis. I explained what that means. Patients that have chronic unexplained headaches. I explained what could be going on. As an introduction, normally we should expect to have some degree of clot when we cut ourselves. If you have an injury, the expectation is that you put some pressure there. Have you observed that after a while it stops bleeding? The reason why that happens is because the body is structured in such a way that when there is a cut, the coagulation factors come together to ensure that we don't bleed to death, and so the bleeding is stopped. Now, there is a balance between pro and anticoagulation. I explained what that means. There is a balance between the factors that are in favor of, factors that have a tendency towards or a propensity towards clotting, and then factors that are against clotting. So there is a balance, there is an equilibrium between pro and anticoagulation. So because of that balance, blood flows through every part of the body without problems. There is no clots within the circulation because there is a balance existing between pro and anticoagulation. We'll come back to that in a moment. In this condition called antiphospholipid syndrome, it's an autoimmune disorder that causes abnormal blood clots to form. An autoimmune disorder that causes abnormal blood clots to form. What's an autoimmune disorder? I'll put a description, a link for the video I had some time ago on rheumatoid arthritis, where I explained the concept of autoimmunity. But in summary, autoimmunity simply is a situation where cells of the body that are supposed to protect the body now attack the body. So in simple terms, it is self-attacking self or self-destroying self. In this concept of autoimmunity, with respect to antiphospholipid syndrome, it's a situation where in the cell membrane, there are fat molecules called phospholipids. For some reason, some patients develop antibodies that attack and destroy these phospholipids. Phospholipids in the cell act as a barrier for the cell. When these phospholipids are destroyed or damaged, what happens is then that the cells now have a greater propensity towards forming blood clots. And so if you have a situation where the tendency towards forming blood clots increases, remember I talked about the balance between pro and anticoagulation factors. In this situation, because those membranes have been damaged, the tendency towards forming clots increases. So you have a situation where pro factors now are more than anti factors. Therefore means that there will be a greater tendency for blood clots to form. Now, what are the symptoms? The symptoms will be dependent on where these clots form in different parts of the body. If the clots form in the lungs, in the blood vessels in the lungs, the patient will present as pulmonary embolism, where they have chest pain and shortness of breath. If it presents in blood vessels, let's say the veins in the legs, they will have what's referred to as deep vein thrombosis, where there is pain, there's redness, there's swelling, there's increase in the size of that leg. If it presents in the brain, where you have blood clots in the brain, you could have patients presenting with stroke, memory loss, or chronic headaches. If it presents in the skin or affects the blood vessels in the skin, they could present with what is referred to as livedo reticularis. Now, what that simply means, just picture a sponge that has that lacy-like structure. So, just like a sponge, you will have that lacy-like structure occurring on the skin of a patient that has this manifestation. If it occurs in the heart, you could have a heart attack. The patient could have a heart attack. And then, recurrent pregnancy losses. This is the focus of this video. Patients that develop antiphospholipid syndrome can present with recurrent pregnancy losses. Why is this so? If it occurs in the first trimester, that's the first 13 weeks of pregnancy, the reason is that the antibodies that I mentioned earlier that have been formed prevent proper implantation of the zygote in the uterus, in the womb. And so if this is not properly implanted, of course the pregnancy will be lost, unfortunately, and so that can occur again and again in the course of the first trimester. You have a situation where some women have repeatedly lost pregnancies in the first trimester. I'm not saying that this is the only cause of miscarriages. I'm saying that this is one of the reasons why that could occur. Also, if this happens in the second or trimester, that's from 14 weeks and above, the reason could be that this clot has formed in the placenta. The placenta is like a cord that connects the mom and the baby or the fetus in the womb. If this blood clot forms in the placenta, it will block blood supply to the baby. And once you block blood supply, oxygen supply becomes compromised, and so that pregnancy will be lost. These are reasons why you could have recurrent pregnancy losses in a patient presenting with antiphospholipid syndrome. What are the risk factors? Genetic factors. Number 2, gender, more likely to occur in females than in males. Number 3, medical conditions. Antiphospholipid syndrome can be primary or secondary. Primary will mean that it's occurring on its own without any underlying pathology or disease condition. If it occurs in a patient that already has another autoimmune disease such as lupus, then we refer to it as secondary antiphospholipid syndrome. Other conditions that could predispose or risk factors could be viral infections such as HIV, hepatitis C. How is this condition diagnosed? Number 1, the history. If you have a female that has had recurrent pregnancy losses and all these other conditions from hypertension, diabetes, cervical incompetence have been, assessed, and this patient doesn't have any of these conditions, a very important condition that needs to be assessed is possibility of antiphospholipid syndrome. So the history is very crucial. Number 2, a doctor will want to carry out some tests, and if you're not in medical line or you're not a doctor, you don't need to bother about these antibodies I'm about to mention. The doctor will look out for anticardiolipin antibodies, lupus anticoagulant, and beta-2 glycoprotein 1 antibodies. Like I said, if you're not a doctor, please don't bother about the names. How is this treated? If you're seeing a doctor as a patient, as a female, recurrent pregnancy losses, of course, you're seeing a gynecologist, so that's one of the doctors that you should see. But of course, it's important to also see a rheumatologist for treatment of this condition. So you could have that discussion with your gynecologist to possibly refer you to a rheumatologist. And then depending on where these blood clots are formed, you could have systemic or systemic specific specialty. In other words, if it's a pulmonary embolism, you have to see a pulmonologist. If it's a stroke, you have to see a neurologist. So depending on where the clot is formed, the goal of treatment is to reduce the risk of developing this blood clot. So if you can be given medications to suppress the risk of developing blood clots, then you should be able to go on to have your babies. 2 particular medications or groups of medications that could be used will be blood thinners, anticoagulants, and antiplatelets. These are medications that could be used for these conditions. I'll just quickly mention very briefly a very severe form of this condition that is referred to as catastrophic antiphospholipid syndrome. In this situation, patients develop blood clots in different parts of the body suddenly at the same time. And so you could have a patient present with multiple organ failure. This is an emergency that requires very, very urgent treatment. In summary, I've talked about miscarriages occurring from a condition that is referred to as antiphospholipid syndrome. And it's important that you see a rheumatologist to address this condition, to make a diagnosis and address this condition. And as a female, if you've been having recurrent pregnancy losses, please consider having this discussion with your gynecologist. If you've learned something, please subscribe, like, share, and see you next time. Thanks.